Thank you so much. Good evening, everyone. I'm so excited to be here and thank you so much for inviting me. I'm looking forward to an informative evening. So I'll be asking questions throughout the evening. Please feel free to pop them in the chat. I'll be checking it. And then we'll also have an opportunity to ask some questions at the end. So this evening, we'll be talking about quality control and advocating for your health. This is a really important topic because we know that the outcomes, particularly for women of color, are not great when it comes to healthcare. And I want to make sure that we're all feeling empowered and prepared to make sure that we're standing up for ourselves at each and every visit. So first things first, how are we preparing for our visit? Some questions that you should ask. Who should be on your care team? What are some examples of patient-centered language? And when to go where? Assessing levels of care. These are some of the things that we're going to be discussing this evening. So first, a little bit about me. Like we shared, my name is Ashley Umokoro. I attended Spelman College and I graduated in 2010. And I also have a master's in public health from NYU with a concentration in global health, and I graduated in 2018. Currently, I'm the administrative director at Wakefield Ambulatory Care Center, which is a part of the Montefiore Medical Group. I have around 10 years of experience of clinical and administrative management. It's what I love to do. I love advocating for people's health, particularly in communities of color, and letting them know that they have a voice and that they have an opportunity to really take charge of their health and make decisions that are best for them and their families. So let's start with the basics. So one of the things that we have to tackle are the issues in academic provider training. So one of the examples that I will give is called the African American GFR. So a GFR is the glomerular filtration rate, which assesses how well your kidneys are filtering your blood. GFR is measured by something called creatinine, which is a muscle byproduct. And because it is all filtered, only a little secreted, you have to overestimate the GFR to get an accurate number. A study from years ago essentially determined that Black patients had higher rates of creatinine than white patients, so their estimated GFR was actually lower than those of white patients. This means that Black patients will have a lower on average estimated GFR because of this African American GFR. So why is this critical? So when that number is used to determine renal function, it can keep patients off of renal transplant lists. So this is really important when it comes to people who are looking for renal transplants to improve their renal function and to improve their quality of life. We'll also be discussing a little bit about medical racism. What does it look like for it to be implicit bias versus explicit bias? We'll talk a little bit more about that on the next slide. And then health equity and racial injustice. This piece is really important because there are so many systems in place to prevent Black people from advocating for themselves and accessing quality health care. So for example, if we're looking at something like environmental racism and climate change, the people that are impacted the most by these things are poor Black people or in communities of color that don't have access to green spaces, clean air, clean water. We're looking at situations like what's happening in Houston, Texas, or in Flint, Michigan. These people are disproportionately impacted by the impacts of environmental racism. If you're also thinking about things like food deserts, a food desert is a place that doesn't have organic or healthy food close by for patients to access. You can notice that when you're driving through certain cities and neighborhoods, if you don't notice a grocery store, if you only see fast food restaurants or food chains associated with gas stations, this is a clear indicator of a food desert. You'll notice that these places don't exist in white neighborhoods or more affluent neighborhoods. And then additionally, when you look at affordable housing and how zoning impacts the asthma rates. So my clinic is in the Bronx, and the Bronx actually has the highest rate of asthma in children across New York State. And that is because all of the trucks and industrial ports and the bus depots are located in the Bronx. All of those machines travel through that area and impacts the air quality in the Bronx, which increases the rates of asthma for those children. One of the things I want to highlight here is that it's really important to follow the money when it comes to affordable housing and zoning. A previous role that I had, I was the director of pediatrics at another clinic in the Bronx. And there was one day we had all of these like free inhalers and nebulizers, and we just didn't know where it came from. But when you're working in community healthcare, you tend to look at things free as a perk and you want to hand them out to your patients because they don't have access. One of the things that I found when following the money is that the companies that were donating these nebulizers and inhalers for children were actually the truck companies. So they knew that they were creating a problem, and instead of, diverting their truck routes or not traveling through those neighborhoods at peak hours when it would really impact the air quality, they decided to throw money at the issue by providing people with nebulizers and inhalers, which is not the right thing to do. So what do you do at that point? Do you make a decision to accept these free things and actually give it to your patients that you know it can help? Or do you actually then lobby and advocate and say, actually, we need trucks to only travel between certain hours because certain times of the day, the air quality is lower or higher. And these things are helping to bring down the asthma rates in the Bronx. If you can pop into the chat a quick yes or no, is anyone familiar with these two photos here? Okay, we have a couple of yeses. So I want to talk about the first photo here. You will see an enslaved person and a man in a white coat, J. Marion Sims. He is taunted as the founder of modern gynecology. And the way that he studied and researched was practicing on Black women who were not given any anesthesia. And the reason that they were doing that is because there's this perception that Black people don't perceive pain similarly. So they are not given pain medication or options to receive pain management because of this perception. So while there are things that are learned from practices like these, obviously it's unethical. Anyone know the next person in this Black and white photo? I see some yeses in the chat. So this is Henrietta Lacks, or her maiden name is actually Loretta Pleasant. She's a woman from Virginia, and they actually used her cervical cancer cells to conduct cancer research. And unfortunately, she was never properly treated, only used for research, and her family was never compensated. So while her cell line was actually used to contribute to significant cancer research and important scientific advances, the way that they received this information was also unethical. So how are we preparing for our visit? One of the things that you have to remember is that when you visit the doctor's office, it's a partnership. The goal should be to work together with your care team and your clinicians to make sure that you are your very best self. And what does that look like for you? And also you want to establish how you want to be addressed. You may not notice this, but when you're being called to the back now in the doctor's office, it's no longer a Mr. and a Miss. It's last name only. There are processes in place to make sure that people are addressed with the proper gender pronouns that they're looking for, the proper names that they're looking for. You can actually request that you be called by a different name than what might be listed on your government identification, like a driver's license or a passport. There's actually a preferred name line that is included in all of these electronic medical record services. So make sure that you are advocating for yourself in that way and let people know how you want to be addressed. You also want to talk about what your priorities are. So keep track of everything that you want to speak to your doctor about before you get there. Be sure to get ready to ask questions, be prepared with timelines. I've been having X, Y, and Z issue for X amount of time. It'll help them to better guide your care. If your provider is not answering your questions or not answering them satisfactorily, it's important to ask them to document that in your chart. So your medical chart is a legal document. And effective April 5th, actually, you will be able to have access to all of your signed notes from your doctor as soon as they're signed. It's really important to read these notes and make sure that all of the information is accurate. If something is not correct, you do have the opportunity to request an addendum to make sure that it reflects actually what happened at the visit. The only notes that are not shared freely are notes about therapy or about like substance abuse. If you're not feeling comfortable, you can also bring someone with you to the doctor's office. This is not something that people are doing currently because of social distancing, but it's really important to have an advocate if you don't feel comfortable, if you are someone who may be older and you may forget what medications you're taking or how well you're sleeping or some of your other issues. A parent, a daughter, a sibling can actually help you advocate better for yourself at the provider's office. And then finally, if you've tried these tactics and they don't work, you can always ask for another physician. And I think that's something that people forget is that if it's not working for you, you do have the opportunity to switch the people that you're working with and that are part of your care team. So, some important questions to ask kind of toward the end of your visit is when should we follow up on this? If there have been changes that have been made or something that or an issue that you've raised, you want to know when to check back in. Sometimes that can be 3 to 6 months, sometimes it can be in a year, sometimes they might say, I don't want to see you for another 2 weeks or something like that. So, make sure that you get a clear interval on what you should be checking on and how often. What are some of the risks associated with this treatment plan? If you decide to try a new medication, what are some of the side effects? What happens if I don't take it? What happens if I do take it? These things are important to assess, and as well as the benefits of that treatment plan. And if it's something that you're not comfortable with, you can always ask for an alternative. So if you're not comfortable with a name brand medication, you can ask to be prescribed a generic. There are tons of options for you, but you won't know what those things are unless you ask. And then finally, because your time spent with the doctor is so short, you may not have an opportunity to get all of the support that you need. So ask your physician what other resources are available to you today. That can include a health educator or a social worker, a patient navigator who can also support you in the visit to make sure that you're getting the support that you need, and also someone like a diabetes educator or a dietitian as well. So, who should be on your care team? I know this seems like a pretty lengthy list. It may not be something that you're always considering, but these are the people that are going to make sure that you are your whole best self. So, your PCP is your primary care physician, and their focus is on preventative medicine. A dermatologist is someone who works with the skin and they treat those disorders. And a podiatrist is someone who works with the feet and their ailments. Your feet are your base. So it's really important that you make sure that those things are solid. And I know that can be an uncomfortable topic for people, but the podiatrist will really change your life and how you are able to move your body and navigate your day to day. Behavioral health specialists obviously support your mental health and wellness through things like therapy. And I really want to advocate for therapy. It's really important. It's something that I started recently, and it's definitely made a change in the way that I look at life. It helps me to answer questions, better navigate conflicts and relationships. It's definitely something that everyone should consider. And there are so many options these days for free services and for text-based services and call-based services. So definitely something to look out and explore further. So this may seem like a strange one. Your pharmacist, most of us are running to a CVS or Walgreens. We may not necessarily have a relationship with our pharmacist, but this is really critical. If you start taking a new medication, you may not be aware that is interacting poorly with a food that you're eating or the medication that you're on. If you are moving between different pieces of this care team and they're not communicating regularly, they may not know what all is on your formulary, or they may not be aware of everything that you're taking. So it's really important to have that relationship with your pharmacist and say, hey, I was prescribed this new thing. They say to take it, 3 times a day or in the morning with food, but this medication says that I should take this one without food or on an empty stomach. What does it look like to help to best manage that process? And then finally, a nutritionist. So healthy eating is really important in various stages of life, and that looks different in those different stages. So it's helpful to check in with someone about what you're eating and what you're putting into your body. So patient-centered language is something that's really important. And as I mentioned earlier, you'll be able to have access to all of your notes. So these are things to look out for. when you're reviewing your notes to make sure that they're accurate. So, what is something that is like with negative connotations and what should be there as well? So, the things in the first column, language with negative connotations, should not be there. And the things in the second column are more patient centered language. So, for example, if your provider wants to give you a new medication, instead of saying refuse medication, it can be declined or chose not to accept. Instead of demanding or difficult, it can be made repeated attempts. And it's okay to request that these changes be made to make sure it accurately reflects what it is that you're asking for. Instead of being called needy, it's like they sought reassurance. So words are really important here, and it's critical that you work together with your provider to make sure that things are listed in your progress notes and in your close notes as properly as they should be. And something else just to highlight quickly, because it came up in a team meeting about what it looks like for with use of like provider jargon and shorthand. So for example, if you see something like the letters SOB in your progress note, it's not a bad word. It really means shortness of breath, but we're trying to get providers away from using things like that because because it can be confusing and off-putting to the patient. Sometimes you may see an F/U, that means follow up. It's also not a bad word. So these are things to kind of keep in mind when you're reviewing those notes as well. So this one is really important. So I do get this question a lot from my friends about, is it time for me to go to urgent care, the emergency room, or my regular PCP? So this chart here will kind of help you better understand what makes the most sense in terms of where to go and how you're accessing your care. So for example, with your urgent care, it's really on, a same day basis, something that doesn't necessarily need an emergency room, but can't wait until you can make an appointment with your doctor. So if you're having things like a rash or flu-like symptoms or something like unexplained vomiting or something like that, that's a good time to visit urgent care. When it comes to the emergency room, think about broken bones or you have a head or an eye injury, anything that's more severe. If you're having a really high fever accompanied with a rash, seizures, things like that should definitely go to the emergency room. But then when you're thinking about visiting your PCP, you need form completion. So if you need a sports physical or a form for your job or things like that, these are not things that should take up time at urgent care or the emergency room. And the reason that this is important is because you want to make sure that you're getting the proper treatment and that they are addressing your concerns adequately. You are not going to get as comprehensive of a visit at an emergency in the emergency room when it's something that should be taking place at the PCP. They're trying to get people in and out. They're trying to patch things up. It's a very fast paced environment. You're not going to have time to ask a bunch of questions about your issue if their job is to kind of make sure that you're stable and send you on your way, which is really the purpose of the emergency room. So I see one question in the chat. So that's really important that I want to highlight. Is it okay to record the conversation? Um, Technically, no. You are not supposed to be taking photos. You're not supposed to be recording anything in your provider's office. And I know that may come as a shock to some people, especially new parents. They love to take photos of their child's first shot or their first doctor's visit or their weigh-in. You are not supposed to be doing those things in the clinic, but I know that people do it. And then I also wanted to touch on quickly the importance of participating in research. So despite some of the troubling things that I shared at the top of this presentation, it really is important for African American people in particular to participate in research. The concern is that we're being left behind and care should be based on us and what that looks like for the average African American. So currently, the healthy weight for someone or a healthy blood pressure or what your resting heart rate should be is actually based on middle-aged white men. Most of the people or all the people on this call are neither of those things. So are you accurately being assessed when you go to the doctor if they're basing it off of something that they haven't properly researched in a community that looks like you? And to kind of help people understand how research has changed over the years and why it is absolutely safer, is that they've established guiding principles, which you can see here on the screen, they've also established informed care. So now they have an obligation to let you know all of the potential side effects, all of the risks, and also the benefits that could happen from participating in research. So we've all seen commercials for new medication these days that say, oh, these are all the amazing benefits, but these are also all of the things that could happen. And they've tested it out and they know that this is to be true, which is why they have to kind of inform you and let you know that these are risks associated with this medication. So I'm going to pause here for questions to see if anyone has popped into the chat.